Hey, good morning. I'm Vic Senese, and this is UroNurse News. Today's story highlights a hidden risk factor that could delay the diagnosis of bladder cancer: color blindness. For most people, the earliest warning of bladder cancer is unmistakable: blood in the urine. But for millions of people with color vision deficiency, that red flag may not look red at all. I got a brother who's colorblind, and I find out when you ask him what color is that, he doesn't have any idea. New research published January 15th in Nature and Health reveals a troubling connection between impaired color vision and worse survival outcomes in bladder cancer. Researchers analyzed electronic health records from more than 275 million people worldwide. That's one of the largest data sets ever used to study cancer outcomes. Among patients diagnosed with bladder cancer, those who also had color blindness were significantly more likely to die from the disease. When researchers matched patients by age, gender, and overall health, they found that only about half of the colorblind bladder cancer patients were still alive 10 years after diagnosis, compared to roughly 3/4 of the patients with normal vision. Over a 20-year period, patients with color blindness faced a 52% higher risk of death. So why the difference? According to Mustafa Fada, a bioengineer at Columbia University and one of the study's authors, the explanation isn't the cancer itself. Impaired perception of red is usually the driving force here. The most common first symptom of bladder cancer is painless blood in the urine. If someone can't easily distinguish red from brown, gray, or darker yellow, they may not realize anything's wrong. That delay, weeks, months, sometimes longer, can mean the cancer is more advanced by the time it's finally diagnosed. And advanced bladder cancer is much harder to treat. And let me tell you, that red flag, when you have a patient seeing blood in their urine, they're on the phone right away complaining, hey, gotta get me in, something's wrong. So researchers also asked an important question. Does color blindness affect other cancers with visible bleeding? They examined a patient with colorectal cancer, which can cause blood in the stool. This time there was no difference in survival between patients with and without color blindness. Why? Because colorectal cancer has routine screening programs that often catch the disease before symptoms appear. You know, your colonoscopy. Bladder cancer doesn't. For bladder cancer, there's no recommended screening for people without symptoms. Maybe the UA, which can check for microscopic hematuria. That means detection relies heavily on patients noticing subtle changes themselves, and that puts people with color vision deficiency at a disadvantage. Family medicine specialist Dr. Mashihoto Jimbo from the University of Illinois at Chicago, back where I went to school, says that findings should raise awareness among clinicians. I would keep the low threshold to investigate for bladder cancer for a colorblind patient with urinary symptoms. That's definitely somebody you want to be getting urinalysis on. While the data aren't yet strong enough to change screening guidelines, experts say they should absolutely influence clinical vigilance. That means you guys. This matters because both bladder cancer and color blindness are common, especially among men. In the United States alone, about 80,000 new bladder cancer cases are diagnosed every year. Roughly 3/4 of the patients are male, and color blindness affects about 1 in 12 men, compared to just 1 in 200 women. Most cases involve difficulty seeing reds and greens, the exact colors needed to recognize blood in the urine. So the takeaway, if you or your patient is colorblind, don't rely on color alone. Cloudiness, darkening, changes in odor, urinary symptoms, even without that obvious red flag, deserve attention. When it comes to bladder cancer, what you can't see can hurt you. Hey, tomorrow, did you know your brain and immune system could be silently triggering heart attacks? Join me as I dive into groundbreaking new research that links the nervous system, immune response, and heart health, and what it means for you and your patients. Set your reminders. You won't want to miss this eye-opening episode tomorrow.
UroNurse News. Let's learn and share on YouTube, LinkedIn, X, and Facebook. Everywhere, 5 minutes of wisdom for healthcare workers everywhere. Bringing insights through the years.